How do you treat wound dehiscence after surgery? Imagine waking up after surgery and noticing your incision is open or leaking. That can be alarming, but knowing what to do can make a big difference. Wound dehiscence happens when a surgical incision reopens, either partially or fully. It usually occurs within the first 2 weeks after surgery when the wound is still fragile. Recognizing the signs early is key to preventing further problems. You might see the edges of your wound separating, or notice increased pain, redness, or swelling around the area. Sometimes clear, pink, or pus-like fluid may drain from the wound. In severe cases, you could even see tissue or organs through the opening. If you notice any of these signs, contact your healthcare provider immediately. Do not try to treat the wound yourself unless your doctor advises you to do so. Treatment depends on how big the opening is, whether there's an infection, and your overall health. The first step is to protect the wound by covering it with a sterile dressing. This keeps it clean and helps prevent infection. Avoid putting pressure on the area or moving it unnecessarily. Your healthcare provider may clean the wound with sterile saline or another gentle solution. If you're at home, you might be instructed to gently clean the area with mild soap and water, but only if your doctor says it's okay. Managing pain is also important, so your doctor may prescribe pain medicine to help you stay comfortable. If signs of infection are present, such as pus, fever, or worsening redness, antibiotics might be needed. These can be taken by mouth or given through an intravenous line, depending on how serious the infection is. Sometimes, dead or infected tissue needs to be removed through a process called debridement. This helps the wound heal faster by clearing away unhealthy tissue. Special dressings like wet to dry gauze or wound vacuum therapy can be used to promote healing. These dressings help draw out fluids and keep the wound moist, which encourages tissue growth. In more serious cases, especially if the wound is large or organs are at risk of coming out, another surgery may be necessary to close the wound properly. Regular follow-up visits with your healthcare provider or wound care specialist are essential. They will check your healing progress, change dressings, and watch for any signs of complications. If you have underlying conditions like diabetes, poor nutrition, or if you smoke, these can slow down healing. Your care team might suggest lifestyle changes or treatments to help your wound heal better. Remember, wound dehiscence can be serious, but with prompt and proper care, most wounds can heal well. Always follow your healthcare provider's instructions and report any changes or concerns about your wound right away.